Hey guys, I'm Dr. Donna Ferguson. This is video number 2 about how to treat anxiety. I'm going to try to run through this so quickly because, again, I know long videos make people not real interested. I am going to be using my nifty little handouts, and I've got some modifications to this one. So I want you to know, before we get started, that therapy is the first line treatment for anxiety. Medicines do not cure it, with one exception, and I will leave you in suspense for just a minute and get to that at the end or at some point, hopefully. If I forget, leave me a comment and I'll clue you into that. I know that probably surprises you that I say therapy is the most important part, but medicines do not cure anxiety. Therapy is where the work gets done. Medicines can put a lid on it. They can help alleviate some anxiety symptoms. But if you're an anxious person, your first response to life disruption is going to be an anxious response. So a lot of time, if I have not educated people well about meds, maybe they have depression and anxiety, they'll say, well, my depression's better, which it should be. Our goal in treating depression is to eliminate depression, but we cannot eliminate anxiety. We're going for symptom relief there. So we can use the same medicine for 2 different issues, and the response, I get 2 different responses. So that's a little confusing for people because the medicines that we're about to talk about are typically thought of as antidepressants, but we do use them for anxiety for symptom relief. So that's the wrong one. My first line medicines are going to be our SSRIs. Those are serotonin selective reuptake inhibitors. Those are things like Paxil, Prozac, Zoloft, Lexapro, Celexa, those guys. You've all heard of them. And the way that they work, which I think is really important to understand too, it's not like Adderall and Concerta where you take it in the morning and you know that it works that day. These medicines do not work that way. And if you've not been adequately educated about that, you can be very disappointed and frustrated thinking, I should be feeling better and I'm not. And I hear that a lot. So I want to make sure you know these medicines are changing receptors. That takes a long time. I usually don't get any response for 2 to 3 weeks with most of the medicines. Some of them seem to have a little quicker response than others, because they reach steady state a little quicker than others, but they do not have their full effect until 6 to 8 weeks. So if you're getting a little frustrated with your first line treatment, maybe your PCP, your general practitioner has put you on one of these and maybe didn't explain, or whoever didn't explain that it takes a while, please do know that and hang in there, because chances are by the time you get to 6 to 8 weeks, you are going to feel a little bit better. It may not be perfect. You may need a dose increase at that point, but you need to understand that it takes time. So our SNRIs, those are things like Cymbalta, Effexor, Pristiq, Vetsima, those guys. I don't use gobs of them for anxiety disorders. I know Effexor carries an indication for anxiety disorder. I know some people do get benefit from them. I've just had a lot of difficulty in my practice getting people off of them if they're not good medicines. And Effexor people, please don't be haters, because I know some of y'all are married to your Effexor and you love it, and I love it too for certain people. It's not typically my first one I pick for lots of reasons. Mostly probably because I see kids, and there's just more data with Lexapro, Prozac, and Zoloft in kids. So I got really used to using those and find that they work really well. So those are more in my wheelhouse. So then we have other serotonergic agents. Those are things like Viibryd, Trintellix, Remeron, or mirtazapine. So you may have heard of some of those. And then I wanted to make sure that I put this on here, not Wellbutrin, because I see so many people who get put on Wellbutrin for anxiety. And I'm like, oh dear God, no. That is like the worst thing you can put someone on for anxiety, because it does not work for anxiety. It works for depression. It's a great medicine for depression. So sometimes if your issue is depression with anxiety, your anxiety can get better because your real issue was depression. Does that make sense? If your real anxiety or your primary issue is anxiety, Wellbutrin will more than likely make you feel worse instead of better. Do I use Wellbutrin for anxious people? Yes, indeed I do. I use it as an add-on. Sorry, that's my dog. Somebody's here. We're redoing a bathroom, just in case. That's why I'm not on the bathroom floor, in case you were wondering about that too. So Wellbutrin tends to be an add-on if I'm having symptoms, side effects with other medicines. and we'll kind of get to that, why I might add Wellbutrin, but never first line. So my benzos, I want to make sure that you understand a little bit about benzos. I think they're completely misunderstood. Are they overused? Yes. Are they underused? Yes. I think that people sort of fall into this category of I either love them or I hate them, and I don't like that. I like the shades of gray where you sort of look at a person sitting in front of you and say, do you need them, and if so, how? And also, is there a reason we wouldn't want to use them? And if so, why not? So I like to individualize my treatment, not just have a formula that I follow for every single person. So I like long-acting benzos because they're smooth on, smooth out. They are more like Adderall and Concerta, where they work the day you take them. They can give someone some symptom relief pretty quickly while we're waiting on Prozac or Zoloft or Lexapro to kick in. So sometimes that's a helpful way to do it if someone is really, really, really disturbed and having a difficult time and about to fall through the cracks on me. I'm definitely going to use a benzo. I'm probably going to use a long-acting one because there is abuse potential. There is potential tolerance that can build with these medicines. So long-acting tends to have fewer of those problems related to it. Short-actings like Xanax, Ativan, Valium's kind of a middle acting, but the Xanax and Ativan definitely gives immediate relief. Boom, you're relieved. And then boom, the medicine goes out of your system and you're not relieved anymore and you need more. And so you take it again and it's up and down and up and down. And that does lend itself more toward abuse and or tolerance. So I only use those as rescues for like panic attacks or on rare occasions, because I don't want people building a tolerance and then it doesn't work, and it doesn't work as a rescue. I do prefer the long-actings. That would be something like Klonopin or clonazepam or Xanax XR. So if you were at my office and I found reason to use them to maybe help you get over a hump, I probably would not want to leave you on them long term, because again, the longer on them, there is more potential for tolerance, and then your body doesn't respond to them as well as it used to, and then you need more, and then we sort of start this cycle of needing more and more and more and more. So I might use it short term and say once your Prozac kicks in, we'll try to get rid of that. So that's how those work for me. And then I have other here. I do use some other agents for anxiety. Let me see if I can get you a good snapshot if you want that. There we go, right? Vistaril, some people use for anxiety. It's got some antihistamine properties. It can make you sleepy, but it's good for sleep. And sometimes people use it as needed during the day, but it can make you a little bit sleepy. Propranolol is a beta blocker. So it's a heart blood pressure medicine. I love, love, love propranolol for just slowing things down. It slows your heart rate down. It helps with the shaky hands. It's really a great medicine for the physical symptoms of anxiety. If it works really well, it only lasts about 3 to 4 hours. So if it works really well for someone, I might switch them to the longer acting version, which is Inapran XL. So sometimes I'll use that. Gabapentin is fantastic. A lot of neurologists use it for migraines. I use it for anxiety. It can also be a little bit sedating, so sometimes I'll use less in the morning, more at night. And so those are some other creative ways when I'm running out of ideas. I start reaching for things, and those are some things that I have found to be very useful. I also forgot to put on my list Buspar. Buspar is not for everybody. Some people find they get benefits, some people don't. I think it gets a bad rap because I've actually found it's more useful than I was taught. You do have to build up on the dose. You have to start slow because it can cause nausea and dizziness, and if you start too high too fast. And so if you start low, use it twice a day. Sometimes I'll do twice a day and then as needed, and start at 5 milligrams twice a day, work up as needed. But you can get up to 30 milligrams twice a day. So there's a lot of room to move on that one. It's older, it's cheaper, you can get it without having to jump through a bunch of hoops. So I like that a lot. When would I use which ones and what do they do? I will get to, but I want to show you a little bit about how they work. So here's this graph from the first video, and what you're going to notice, I've added some red lines. And so this is how this works. Just a recap for our anxious people, this line is their threshold of where they feel anxiety. So anything that pops over that line, they're feeling anxious. You can see our anxious people feel anxious almost all day long, every day. our neurotypical people here, this is their threshold. And this, anything that pops over their line is where they feel anxious. So it takes a lot more for them to feel anxious, but they do still feel anxious. So, and we talked about how anxiety is good. It can help you study for tests. It can help you get motivated to do a project you need to do at home. So we don't want to completely wipe out people's anxiety. We want to leave them with a little bit. But let's just use Prozac for example. Let's say I start Prozac 20. I might be able to get someone up to this red line. So now let's look at this anxiety person. This would become their new threshold. And so if they're late for work, instead of feeling it this much, they're going to feel it that much. See that difference? So it's awesome. Not perfect, but awesome. So we go down here to failing a test. If they were in their normal untreated anxiety state, they would be here. With their treated state, we take a little bit of the edge off. With each dose increase, that's the next red line and the next red line and the sort of the next one that ran together there. What you're noticing, or I didn't quite draw it in a way that makes perfect sense, but you kind of get diminishing returns. With each increase, I don't get quite as big of a chunk that I take out. So say I start at Prozac 20, I get a big chunk. When I go to Prozac 40, I get another little chunk, but it still brings it up a little bit. So again, when you're at this level, you don't feel maybe the day-to-day fluctuations. You're feeling just some of the bigger things. You do still feel them. You are still an anxious person. You're still going to feel them. Prozac, let's say 60 or 80, may get you here. It's still not going to make you neurotypical. So I want you to be sure to notice that, because I had someone recently who came in and said, I'm still really anxious and you have me on all these meds and I'm still anxious. I said, you're going to be. Are you in therapy? And they said, no. And I said, well, no wonder you're anxious. That's where the work gets done. And we've talked about that. So go get in therapy. So what I will use varies depending on your anxiety disorder. So for generalized anxiety disorder, I'm probably going to use something like, again, our first line medicines first, because you have to now with insurance. You can't just hop to some of the newer medicines. You have to have failed usually a couple of other medicines. That's not always the case. So ask your doctor, ask about your insurance. Every plan's different, but we do have some great copay cards for some of the newer medicines. We just don't always have an opportunity to use them unless you've failed some other things. So let's just say I'm choosing Prozac to use for generalized anxiety disorder. I usually get a pretty good result with 20 milligrams of Prozac. With people who are really, really anxious, I might go to 40. I might even go to 60. The problem is the higher the dose, the higher the chances are for side effects. So people then ask about side effects. What problems can I have? Weight gain can or cannot be an issue. I've seen it go both ways. And these medicines are not the kind of medicines where I hand to you and say, you're gonna gain weight. It does not really work that way. I think that the medicines can make people more relaxed. So if you're really rigid about your eating or your exercise routine and you become more relaxed about that, you may put on a few pounds. It doesn't tend to keep building, but you may be more relaxed and say, yes, I'll have that piece of cake or that glass of wine or whatever. So I do find that sometimes there can be a couple of pounds of weight gain. It's usually not horrific. It's not anything that would make someone discontinue medicine. I had someone yesterday tell me, I really gained weight on that Zoloft you put me on. I said, really? That's so interesting, because you were in college when you were gaining weight, which is pretty normal. You were drinking like a fish, and you're also smoking weed. So why is it that you're blaming the Zoloft on your weight gain? It just doesn't make sense to me. It's so funny to me that people blame the medicine when their lifestyle is not conducive to losing or maintaining their weight. They're drinking too much, gobs of calories, empty calories in alcohol. If you're smoking weed, you're going to gain weight. We know this. If you're not exercising, you're not eating well, you're going to gain weight. So I think medicines get a bad rap when people are not really taking good care of themselves and they want to blame something, and it's way easier to blame me. And that's fine, but I don't believe that that's the case. I don't think people just pack on pounds. Sexual side effects can be a problem for some people, not everybody. It does tend to be more dose related, so maybe someone can tolerate 20 milligrams of Prozac or 40, but when I get to 60, then they may start to have problems. So there are some newer medicines that seem to have less weight gain and sexual side effects associated with them. Those are Viibryd and Trintellix. And I do find that there does seem to be a better side effect profile with those medicines, but they're newer. You have to have the copay card. You have to have commercial insurance to use the copay card. So if you failed on a couple of these things and you're ready for something else, that might be a great way to go. Or you can start out that way and maybe see if your doctor can achieve that for you. I just have a little bit of difficulty doing so. So for social anxiety, bad news here is medicine really doesn't help much with that. It may help a little bit with the anticipation of the social event, but once you get there, you're going to still have your social anxiety issues. Medicine does not cure that. So therapy is where your work is done. For panic attacks, that's the one that medicine cures. If I can get you to the right dose, you should no longer have panic attacks. End of story. So it's a beautiful thing. I love when I get a panic attack person who's so miserable and I can get them to the right dose and they don't have them anymore, which is just amazing. Excuse me. I have the gunk this morning. OCD. OCD is a little hard to treat. I mentioned that in the anxiety video number 1. I usually have to go to really high doses of medicines. So that limits me to the medicines I can use because I cannot push certain doses past a certain point due to insurance, due to labeling. So I typically use Prozac, Luvox, Zoloft. Those medicines I can push really high and get good results for OCD. Good not meaning that the symptoms go away. They're still there. We still need therapy. Usually cognitive behavioral therapy is the therapy of choice for OCD. But expect really high doses. That freaks a lot of parents out, but I have to explain it. So I'm explaining it here so y'all can watch the video. I don't have to keep repeating myself. PTSD, kind of bad news here. Also, as far as medicines, you've experienced something really traumatic and awful. Medicine isn't going to cure that. It can, again, take a little bit of the edge off the symptoms so that you're not so debilitated, but therapy is where the work gets done for PTSD. And it's also where I find that my horse therapy works really, really well. And there's lots of research for PTSD and horse therapy. So that's really a cool way to do it. We have some therapists who have here in town who have specialized in PTSD, and hearing so many people's traumatic stories have sort of taken a toll. And, that's why I think the horses work so great for that, because I don't have to hear every detail of every story and be traumatized by the story also. Not that I don't want to hear the story, but you know what I mean, every single little detail. Phobias, therapy is where the work gets done there. Separation anxiety, test anxiety. Oh, test anxiety and performance anxiety are really cool because we don't typically use SSRIs for those. We will typically use the other chart. The propranolol. Propranolol is a beta blocker, and it takes that heart rate down. So if your body doesn't feel nervous, it kind of goes through the back door. And people will say, so I'll show you again. Propranolol is over here on other. People will say, well, my heart's not racing, my hands aren't shaking, so maybe I'm not really nervous. And it kind of goes through this backwards way of affecting us so that our bodies don't exhibit the symptoms and our brains then relax and we're able to think through tests. And if you have to give a performance or you have to give a speech or something like that, propranolol is fantastic. It lasts about 3 to 4 hours. If you need more time, again, I might move to the Inapram. Let's see. Depression with anxiety, we got to treat the depression. That's how you treat that. And if anxiety is still left over, we can always add something. And same with adjustment disorder with anxiety, I typically will treat that more like a generalized anxiety disorder. I believe that I have covered the main points that I wanted to make about medication and therapy treatment for anxiety disorder. Please, dear God, get both, because when you're not, it makes our job so much harder. Limit your drinking, especially if you're on benzos, because benzos can exacerbate the effects of alcohol. I've really seen some people get into trouble if they're drinking and using their benzo. You're going to be way more disinhibited and have much more difficulty. So you want to limit and or discontinue drinking. Follow the advice of your professional. And just because I'm telling you how I do things, please don't bring my video to your psychiatrist or your PCP and say, this is how I need you to manage my meds. Everybody has their own style. I'm just telling you how I do it so that maybe you have an understanding of some of the conversations I have with people in my office. it might enlighten you to some of the ways that I think about these issues. So hopefully that's helpful to you. I'm sure there's something I left out that you're going to want to know more about. And if so, doggone it, I'll make another video if I have to. But you can also comment and I'll try to answer questions, because I know there's a lot kind of crammed into, what do we do, 20 minutes? That's pretty good. I figured it would take longer than that. But if you need more information, I will do my very best to answer it in comments. And that way other people can have the benefit of whatever your questions might be. I don't have favorites. Oh, one thing I didn't talk about was why I might use one SSRI over another one. I typically like Prozac, Zoloft, and Lexapro, and I mentioned that because they've been around a long time and I can push the doses. What I did not tell you is that I also like, so Prozac tends to be my go-to for a lot of things because it has an extremely long half-life. So what that means is that it takes a long time to build in the system, like all the SSRIs, so you're not getting better overnight. However, if you miss a dose, you don't have discontinuation syndrome, which you may have with some of the shorter acting ones. So if I'm dealing with a kiddo who spends half their time with mom and half their time with dad, and their stuff is back and forth and they forget to bring their meds, or if I'm dealing with a non-compliant person who only remembers to take their meds 2 or 3 times a week, Prozac and Trintellix, those are our 2 longest half-life medicines. Those are good choices for those kinds of people, because if you miss a couple of doses, your levels do start to drop, but you're not going to have an abrupt discontinuation syndrome. So anyone who's ever been on Zoloft or Fexer, especially maybe Cymbalta, those kinds of guys, and you've missed a dose or 2, you might feel like you have the flu. It's called discontinuation syndrome. The cure for that is to go take your medicine, and within about 10 minutes you should feel better. So that's not a reason to not use those medicines. It's just something you need to be aware of and be super compliant and make sure you take it around the same time every day. And the only other thing that I guess I could throw in here is generics. Sometimes with generics, we do run into trouble because they only have to hit it at 80% of the dose range. So, and pharmacies will buy from the cheapest company each month. So if your medicine looks different from month to month and you feel like you're actually getting a different result from month to month based on the pharmacy, based on what pill you're taking, then it may be worth going to a brand name medicine that's going to be exactly the same every single month. And sometimes we can even write, as a prescriber to your pharmacy, brand name medically necessary. So if you struggle with some withdrawals or with your response to medicines, be sure to tell us and we can make that known to the pharmacy and your insurance company, and hopefully you can get what you need. Sometimes you can't. So anyway, hope that helps, and y'all have a great day.